Hey, what's going on, guys? This is Tyler, pharmacist with Pharmacy Update. In today's video, we are going to discuss the drug Ozempic, or semaglutide, which is used to treat type 2 diabetes. It's a fairly new drug. It's been out for around 1 to 2 years now. I have seen an increase in the number of prescriptions for Ozempic here recently. Does seem to be getting more popular with doctors, at least in my area. But today I will be giving some information on this drug, including just a general overview of Ozempic, the warnings and contraindications, including a black box warning, side effects you may experience if you use Ozempic, and then at the end of the video I will be discussing this drug and weight loss. This seems to be a question that I get a lot about Ozempic, if you can lose some weight or not, so I will be covering that today. So here we go. First here, I want to cover some general information on Ozempic. Like I said, it is used to treat type 2 diabetes. Along with diet and exercise, it can be used to lower blood sugar. And one nice thing about Ozempic is that you only have to give yourself one dose per week. So you will be giving yourself less injections than some other products, such as Victoza. Victoza is a once daily injection. The drug class for Ozempic is known as the GLP-1 receptor agonists. So this drug mimics a hormone that is produced naturally in your body, GLP-1. And what GLP-1 does is it stimulates your pancreas to make more insulin, but it is dependent upon how much glucose is in your bloodstream. So there is a low incidence of hypoglycemia when this drug is used alone. Also, it lowers the secretion of the hormone glucagon. And glucagon increases blood glucose levels, so lowering its secretion also helps lower blood sugar. Ozempic also delays gastric emptying, which means that it delays the passage of food or whatever is in your stomach into the lower intestine. And this delay in gastric emptying does have pros and cons. This delay can cause you to lose some weight possibly, which we will discuss, but it can also cause some side effects. Another thing you will want to consider is that this may also cause some of the drugs you take to absorb differently. In the trials they conducted, there were no clinically significant changes in drug absorption, but just something to be aware of, especially if you take a narrow therapeutic drug such as warfarin or levothyroxine. Alright, now on to my next topic here, the contraindications and warnings for Ozempic. I'll start off by giving the black box warning, and this goes for all GLP-1 receptor agonists. This isn't special for just Ozempic. But they have found in animal studies that giving GLP-1 receptor agonists can cause an increased risk of developing thyroid C-cell tumors. However, it has not been proven if this increased risk also applies to humans, but this is still something you'll want to be aware of. And that leads me into the contraindications for this drug, which basically means if you have one of these conditions, you will not want to take Ozempic. First one here is a personal or family history of medullary thyroid cancer. This ties in with the black box warning. So if you have any kind of history of getting these tumors, you obviously do not want to increase your risk even further by using a GLP-1 agonist. Also, any history of multiple endocrine neoplasia syndrome type 2, or MIN2, you will want to stay away from Ozempic and really any GLP-1 agonist. Warnings and precautions. There have been patients that have gotten pancreatitis while taking Ozempic. This was noted in the clinical trials that the group getting Ozempic did have a higher chance of developing this. So if you have any history of pancreatitis, you may want to consider other therapies. There is also an increased risk of developing gallbladder disease when taking this. This also includes the development of gallbladder stones, and in some cases, patients have had to get their gallbladder removed, so this is something else you will want to know. Now we will move on to possible side effects you can experience, and I did not list every possible side effect here, just ones I wanted to include. As we discussed, Ozempic does cause a delay in gastric emptying, and because of that, it can cause some pretty severe gastrointestinal side effects. And these side effects do occur in a large percentage of people. Around 32 to 41% of people who take Ozempic will experience these. So this would include things like diarrhea, nausea, abdominal pain or discomfort, constipation, and even vomiting in some cases. I will say, however, that these effects are normally the worst when you first start using Ozempic. As you give yourself more doses, the body will start to get used to the drug, and these side effects should start to go away over time. Going along with that, decreased appetite is another possible side effect, with around 6 to 9% of people getting this. And hypoglycemia is quite low when Ozempic is used alone. However, if you start using multiple drugs for type 2 diabetes, especially any kind of fast-acting insulin, this percentage does go up quite a bit. So if you are adding Ozempic to other diabetic medications that you already take, make sure to keep a close eye on your blood sugar so it doesn't get too low. And some other side effects you can possibly get are dyspepsia, flatulence or gas, and discomfort at the injection site for a very small percentage of people. And that brings me to my final topic of the day. Can you lose weight taking Ozempic? And if so, how much weight can you expect to lose? Ozempic currently is not FDA approved for weight reduction, so if you don't have type 2 diabetes but need something to help you lose weight, you will want to explore other options. However, in clinical studies, Ozempic has been shown to help people lose weight, and in most type 2 diabetes patients, that is a very good thing. In one of the clinical trials that they conducted, patients using Ozempic 0.5 milligrams once weekly started the trial with an average baseline weight of 213 pounds, and after 40 weeks, these patients lost an average of 9.3 pounds. So nothing too crazy, but any kind of weight loss is good to see. In the higher dose group, the Ozempic 1 milligram weekly patients, they had a baseline weight of 211 pounds, and this group did lose a little bit more weight. They lost an average of 12.8 pounds after 40 weeks. So the higher dose you use, the more weight you could possibly lose. And obviously, if you weigh a little more than 213 pounds, you can expect possibly a higher weight loss, and also vice versa. If you weigh less than this, you likely won't lose as much weight. But if you're deciding what type 2 diabetes treatment to use, this is a plus for Ozempic and other GLP-1 agonists. But you have to remember the possible complications you can have taking this drug, and you just have to weigh the possible benefits versus the risk. Well, that's all I have for today, guys. I want to thank you for watching. If you'd like to keep up on the latest pharmacy and medical updates, please subscribe to my channel. I also post drug overviews such as this one. And if you have any questions regarding Ozempic, feel free to leave them in the comments below, and I will try my best to get back with you. So thank you guys again, and have a great day.